Yes, a lot of what needs to be done, we do need to escalate a lot of our awareness programs. But the problem that we've had in the previous awareness programs, it was always only the ministry, with minimal engagement of other sectors. So in the new plan that we're putting together, we are wanting to engage other partners like Itaukei Affairs. We want to engage Royal Fiji Military Forces, because the Royal Military Forces have got a big civilian budget. So they probably will start to, once they start engaging into doing a lot of engineering work, we are hoping that we can also utilize that outreach with HIV awareness. Likewise with the police force, as they go out and do outreach, we are hoping to put in our HIV awareness programs with them. And likewise with any other government entity, as they reach out into the community, we also want to put the thematic area of HIV and AIDS prevention. But more importantly, for them to be more able to discuss more openly issues around sexual health. Because for us, sexual health is really the biggest discussion. Our problem with HIV/AIDS is the fact that it is a stigma. And the stigma is undermining our ability to respond. I get rid of the stigma, or at least we mitigate and reduce that stigma. We allow people to talk more openly about sexual health. They were more likely to be able to mitigate the problem of HIV and AIDS as a as an issue. I must add, I must also say that one of the key aspects of the program will be to re-look at the way that we run our program, so that we can share information better. One of the problems with stigma is stigma reduces your ability to share information. But if you share information within a confidential group, you're more likely to build up better follow-up. We are more likely to ensure that all those who need to be treated can get treated. One of the key messages that we also want to put out about stigma with regards to HIV and AIDS is that we now have the ability to give a person with HIV medicine such that their viral load will be so low that most of them will just die of old age rather than anything else. Or they'll die of another disease, but not from AIDS. That's how good the medicines that we have with us at the moment. But the only issue is to make sure that those who are positive are diagnosed first, and then they are on the treatment, and every time they default, we have a reminder or a team of reminders that will go and ensure that they get their treatment and their follow-up done properly.